ಸರ್ ನಮಸ್ತೆ. ಶುರು ಮಾಡಿದೆ ಸರ್.
ಸರ್.
ಸೊ ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಗಳು. ಇಂದಿನ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಖ್ಯಾತ ಹೃದಯ ತಜ್ಞರಾದಂತಹ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ವಿ ಸಾಗರದ್ರವರು ರೋಗಶಾಸ್ತ್ರ ಹಾಗೂ ಅದನ್ನು ತಡೆಗಟ್ಟುವಿಕೆ ಎಂಬ ವಿಷಯದ ಮೇಲೆ ತಮ್ಮ 2ನೇ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮವನ್ನು ಇದು ನೀಡಲಿದ್ದು, ಅವರನ್ನ ಈ ಒಂದು ವಿಜ್ಞಾನ ಪ್ರತಿಭಾಶೋಧ ಯೋಜನೆಯ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮದ ಈ ಒಂದು ಭಾಗಕ್ಕೆ ಅವರನ್ನು ಸ್ವಾಗತಿಸುತ್ತಿದ್ದೇನೆ. ಐ ವೆಲ್ಕಮ್ ಟು ಯು ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಶಾಲ್ ಐ ಸ್ಟಾರ್ಟ್?
ಎಸ್ ಸರ್, ಎಸ್ ಸರ್.
ಓಕೆ.
ಅದೇ ರೀತಿ ಇಂದಿನ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮ ಹಾಜರಿರ್ತಕ್ಕಂಥ ನನ್ನ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿ ಮಿತ್ರರು, ಉಪನ್ಯಾಸಕರು ಹಾಗೂ ಶಿಕ್ಷಕರು ಮತ್ತು ನನ್ನ ಸಹೋದ್ಯೋಗಿಗಳು ಕೂಡ ಈ ಒಂದು ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತವನ್ನು ಬಯಸುತ್ತಾ, ಓವರ್ ಟು ಯು ಸರ್.
Thank you very much. We are actually the second part of our talks. So on Monday we discussed about anatomy and physiology of the heart, that is ಅಂಗರಚನೆ ಮತ್ತು ಶರೀರ ಕ್ರಿಯಾಶಾಸ್ತ್ರ ಅಂತ ಹೇಳ್ತೀವಿ. Anatomy and physiology we discussed. So once you know anatomy and physiology, then we can think of what are the problems occur in the heart and how to deal with those issues. As students, you will not require too many complex issues regarding heart problems. Those who are trying to enter medicine and those who want to pursue medical course subsequently will have some advantage of knowing what are the heart problems, so that subsequently they can use that knowledge in future. But others, what is important is nowadays heart problems have increased in the society, and we are seeing more and more younger people getting heart attack and getting sudden collapse, suddenly dying. 2 years back, you know that Puneet Rajkumar suddenly expired. So after that there are so many things have happened in the society. And also after the incidents of COVID, many people are thinking that sudden cardiac deaths are happening because of COVID vaccination, and all those discussion takes place in social media especially. So it is better to be aware of what problems especially the younger society is facing nowadays, so that future generation can be very healthy if they adopt a very good lifestyle. So let us know, before going into pathology and how to prevent, we should as an individual, as a layman also, not as a doctor or someone else, we should know the definition of health. So what WHO has said about health is, it is complete physical, mental and social well-being, not merely absence of disease or infirmity. That means it is defined in 3 dimensions. One is the physical health. We talk of heart rate, we talk of blood pressure, we talk of our sugar levels, we talk of our cholesterol levels. So all those parameters, they come under physical health. That means our body is physically functioning normally. So complete physical well-being, that is one aspect. The second aspect is very important nowadays, is the mental health. So nowadays even the mental health problems have increased enormously, because everyone in life faces a lot of stress. So because of that, mental issues have become very, very common. So WHO says you should be completely, man should be mentally healthy. So that is second aspect. The third aspect is social well-being. See, in health, this is also included, because health is not restricted to individuals. It is actually interpersonal relationships, how we are living in the society, how is our lifestyle, how we are adopting with the situations which are occurring. So social well-being is also very important to say there is a complete overall health is there. So WHO, that's why said complete physical, mental and social well-being should be called as health, not just absence of disease or infirmity. That means I don't have fever. Does it mean I am healthy? I don't have raised sugar levels. I don't have diabetes. I don't have hypertension. Does it mean health? No. It has to be physical, mental, and social. Complete well being should be called as health. And also, the fourth dimensions has been added. That is nowadays we discuss about spiritual health. So, no, Indian philosophy, what we call the traditional, the thinking of Indian mindset is we should attain a spirituality. So, the spiritual health, so that is also an important pillar and component. The fourth dimension of health is spiritual health. So every individual who is listening to this topic should be aware that we should be physically healthy, we should be mentally healthy, we should be socially healthy, and we should be spiritually healthy. Then only we can call ourselves as an healthy individual. So when we talk of health, the counterpart is ill health or disease. So, what are the diseases which are occurring in the human being or in the society? We divide it into two groups. One is we call them as communicable diseases, and another group we call them as non-communicable diseases. Communicable diseases means it spreads from one person to other persons. No, we saw COVID in 2019 and 20, how horrible it was. So it was communicable from one person to other person. So that's why quarantine was introduced. That is the word which became very buzzword, quarantine. So whoever gets fever or respiratory symptoms, they were isolated even before they get tested positive. So isolation was one of the mode to prevent these kind of communicable diseases. So we have many variety of communicable diseases like malaria, filaria, uh, now H1N1, HIV. There are so many infectious diseases are there which are transmitted from one person to other person. But there is a group of diseases which are not transmitted from one person to other persons. They are called non-communicable diseases. Like we have diabetes, sugar patient. The sugar patient, he suffers himself. That will not be transmitted to another person. Like that, we have a cancer that cannot be transmitted to other person. Like that, we have hypertension. So high blood pressure. So heart attack. So all these kind of diseases are not transmitted from one person to other person. They are called non-communicable diseases. So among non-communicable diseases, nowadays the society is facing a huge burden of cardiac problem, that is heart attack, sudden cardiac death. So we should know how, why heart attacks are occurring and why sudden cardiac deaths are occurring, how we can prevent these, so that the social burden, economic burden, family burden which is associated with these diseases can be prevented or reduced. So when we talk of heart diseases, so yeah, these heart diseases can be congenital. That means when the heart is developing within the uterus in the womb. I said between 4 to 6 weeks, heart starts developing after the conception, and then it starts beating after 6 weeks, and then it continues to beat in the last lecture. So when this organogenesis, that organ is forming, if there is any problems, then there will be defects in the heart. So these are diseases which are called as congenital heart diseases. And subsequently after birth, the patients may develop different kinds of heart diseases. In anatomy, we studied that there the part of the heart we were discussing, that is there were four chambers, there are four valves, and there is a muscle tissue that is called myocardium. We have covering layer which is called pericardium, and there is a endothelium and endocardium. Then there is a electrical system, conduction system is there, which actually regulates heartbeat. And also these muscles are supplied by arteries, they're called as coronary arteries. So each part of the heart can be affected because of diseases. So we can divide it into valvular heart diseases, the problems related to valves. and then there are problem related to heart muscle proper, and there may be problem with the blood vessels, that is coronary artery problems. Then there is a conduction system problem, the electrical wiring problem. Then we have a problems in the pericardium, which is the covering layer. So many problems can occur with the heart. So these are the different types of diseases. So this is one book which last time mentioned, that is the discusses about the various heart diseases and how to deal with that. So this is the last time we saw this picture, that is a cut section of the heart which showed four chambers, right side, left side. Then we have a septum, intraarterial septum, interventricular septum. Then we have four valves like mitral valve, aortic valve, pulmonary valve, tricuspid valve. This is the interventricular septum. This is the muscle which will contract. This is the left side of the heart. This is the right side of the heart. There will not be any mixing. So let us see where problems can occur in the heart. So we can discuss about congenital heart diseases where the developmental problems will be there. So this is, you can see this picture. See here there is a interarterial septum. Interarterial septum is actually separating left and right atria, so that there will not be any mixing of the left side of the blood and the right side of the blood. If there is any developmental problem, then this septum may not properly develop. So then there may be a hole in the this interarterial septum. This is called as atrial septal defect. So this we can detect when child is born. There are symptoms, then we do, last time I showed you the scanning echocardiography machine, so that can detect this kind of holes in the heart, and these holes can be repaired. I have shown the second picture here. You see there is a septal defect here. Then we have placed a device which actually occludes this septum. This is called ASD occluder. So this will be like this. So percutaneously we can place this kind of devices in the septum, and we can close intraarterial septum. So this is called atrial septal defect, and how to treat this atrial septal defect with a device. So this is one of the problem which occurs congenitally, and this can be treated. And also in the ventricular septum, this is left ventricle, this is right ventricle, and you can see there is a defect here because there is a developmental problem. So we call it as ventricular septal defect. So similarly, now the left sided blood can enter into right side. So oxygenated blood can get into the deoxygenated blood. There will be mixing of the blood. So this also, this VSD can be detected by echocardiography, and this also can be closed just like atrial septal defect. This ventricular septal defect can be closed with a device. We place it percutaneously without surgery also. We can place this device and close. So such kind of problems can occur because of developmental problems. And there will be multiple problems in the congenital. Sometimes there is a hole, then the valve is not opening properly, then the right sided blood, the deoxygenated blood goes into left side. So there will be mixing of the heart blood. So that will produce bluish discoloration of the baby. So that is called, so we call it as a blue baby or a cyanotic heart disease. So that is a complex problem that we treat with surgeries. So this is just a general awareness that there may be congenital heart diseases, there is a developmental problem. So these things can occur in the children when they are born. Now next we goes to what are the other pathologies. We know that there are four valves in the heart. So these valves actually, last time I told, they regulate the blood flow. Blood flow has to be unidirectional. So from one chamber to other chamber, blood has to go. It should not come back. So from left atrium to left ventricle, right atrium to right ventricle to pulmonary artery, left ventricle to aorta. Like that, the blood flow has to occur. These actually regulate. But sometimes just like in our home we have doors, so these doors can get damaged, the doors can be jammed, the doors can fall off. So such kind of problems can also occur in the heart. So you can see here, this is the normal valve which is very nicely closing and opening. So but sometimes what happens, this valve leaflets will not close properly, that time actually blood actually returns back to the original chamber. So we call it scientifically regurgitation, we call that. So there may be, if the mitral valve is a problem, then we call it as mitral regurgitation. If there's a problem in the tricuspid valve, we call it as a tricuspid regurgitation. So such kind of the valve closure problems can occur in the valves. So also this is the normal valve you can see, and yeah, the valve is not closing like that. We can have problems. So the valve is not closing properly, then the blood will return back to the original chamber. So such kind of problems can occur in the valves. And also similarly, the valve, you can see this is the valve which is opened like this. So it should open like this. Sometimes the valve will not open properly. So you can see the size here. This is the size of the normally opened valve. This is almost less than 50% of that valve. So this is, we call it as stenosis. So valve can be stenosed. Once valve is stenosed, the blood has to forcefully flow across this valve. So this will also produce problem to the patient. So valve can be either leaking, or valve there may be obstruction and stenosis. So these kind of problems can occur with the valves. So when, how we treat these kind of valves? So if there's a valve is damaged very badly, then we can operate and place a mechanical valve which has been, which replaces the normal valve. You can see an image of the mechanical valve here. So this is a mechanical valve which will be placed by removing the original destroyed destructed valve, and we can place surgically this valve here, and this will function as a normal valve. There are many kinds of valves which are available in the market. So we use different valves for the different mechanical valve for a different valve. So mitral valve, aortic valve, pulmonary valve, tricuspid valve. So all these things can be replaced with a artificial or a mechanical valve, which are made up of some stainless steel or some other materials. So cobalt, chromium, nickel, there are many varieties of materials are used for preparing these kind of valves. So we have discussed about congenital heart diseases where there may be opening or holes in the heart. And subsequently, the second problem is there may be problem with the valves. So valves closing and opening problems may be there. This can be repaired surgically by placing artificial or mechanical valves. The third important problem which we can appreciate in the heart is electrical problem or conduction system problem. We all know that the heart is beats around 70 times per minute, and whenever you are sleeping, your heart rate will be less. When you exert, your heart rate actually increases. But sometimes, just like in our home, electricity goes off, or there may be wiring short circuit, the bulb goes off. So there are many kinds of problems occur with electrical circuit in home also. Similarly, in the heart also, electrical problems may occur. The pulse generating place, which is called the SA node, sinoatrial node, it may not function. So there may not be generation of the impulses. Or the I showed you wiring system, which goes from SA node to AV node to other bundles, and it spreads. So if these branches or electrical wiring system gets damaged, then the impulse which is generated, it may not flow across the heart. So that time the impulses will not be generated, or it will not be conducted. Similar, you can see I have shown two ECGs here. Here is a one complex and one beat and one beat. You can see the difference here. You see the second one, there is a long distance. That means the beating rate has come down in this patient. So we call it as bradycardia. That means heart rate has come down. So patients may have a problem of slow heartbeat. So the slow heartbeat may be because of the impulse generating SA node is not working properly, or there may be wires have been burnt. So for such kind of situation, what we do? See, in home, if there is no electricity, then either we use battery or we use inverter. So that will compensate for it. So like that, whenever the heart beating is slow or less, what we do is we can place a machine called pacemaker. This will act like an inverter. Whenever there is a heartbeat goes down, then this inverter comes into, it will sense that heartbeat is going down, spontaneous heartbeat, then it starts giving impulses to the heart. So this is called pacemaker. So these pacemakers, these are very small instruments. These can be implanted within the body and they can be connected to the heart. Like you can see here, this is the pacemaker pulse generator, and a wire has been inserted through the vein into the right ventricle. It is connected here, so that this makes a circuit. So whenever there is a fall in the heart rate, these pacemakers can give impulses. So this is how we can treat low heart rates. And another problem is fast heart rate. If heart rate can become, normally it is 70, but sometimes it can goes to 300, 400, 500, 600. That time patients may suddenly collapse. So this is called ventricular tachycardia or ventricular fibrillation. You might have heard that suddenly somebody was all right just 5 minutes back, and suddenly they collapsed and they are no more. So such kind of sudden cardiac death, what we call, is mainly because of these kind of heart beating variations. So once there is a heart beating variation, so patient may suddenly collapse. So this we call it as arrhythmia or ventricular tachycardia or ventricular fibrillation. These can also be treated with either medicine or by equipments. Now we come to another important part of the heart problem, which we will focus more, because that is the burning issue nowadays. Because you all might have heard that somebody had heart attack, somebody died because of heart attack. So you may be hearing now and then. So because nowadays the most important cause of death is heart attack, especially not only in elderly person but even in younger patients. We are seeing in our emergencies 30-year, 35-year-old persons coming with chest pain and collapsing. So why this is happening? What is the definition of heart attack? We will know. See, last discussion I told you that muscle, what we call it is myocardium in the heart, that muscle has to contract and relax. So then only pumping will occur. So for contraction and relaxation, it also requires oxygen and other food materials. So those oxygen and food materials are supplied by small channels or small blood vessels, and they are called as scientifically coronary arteries. You can see in this picture, there is blood vessels which are running over the surface of this heart. So these are called coronary arteries. These coronary arteries actually supply oxygen and other nutrients to the muscles of the heart so that they can function. Suppose if there is a problem in these coronary arteries and there is a cutoff of the blood supply to the muscle, then muscle will not receive oxygen and nutrients. Once it doesn't require receives muscle oxygen and other nutrients, then the muscle will die. So that is when the obstruction occurs in these coronary arteries, or because of some reason, and if there is no blood flow to the muscle, then the muscle will die. So this is the situation which we call it as heart attack. So heart attack is nothing but it's a obstruction of the these coronary arteries, leading to decreased blood flow to the muscles of the heart. So this is a very important cause of death nowadays. So you can see here, this is the what we call it as X-ray picture of the heart blood vessel. We call it in cardiology, we call it as coronary angiogram. Angio means blood vessel. Angiogram means you are actually visualizing or seeing the arteries. So it's called angiogram. Since we are doing it in the coronary arteries, we call it as coronary angiogram. You can see this is the left sided artery, which actually called as left main coronary artery. Then it divides into two. Normally we say there are three arteries in the heart. So two on the left side, one on the right side. So left, we have two vessels, left anterior descending artery and left circumflex artery, and right side we have one right coronary artery. So if there is any problem in these blood vessels, then the heart attack will occur. So this is the angiography of the left side of the heart. So that is that I showed you a still picture. this is a still picture. You can see this is a motion picture. So this is how the blood will be flowing in the arteries. So this is, we actually inject a contrast material into the arteries and then take a X-ray picture. This is the motion picture. So this is the video. So this is the left side of the heart. And similarly, on the right part of the heart is also supplied by one of the coronary artery. It's called right coronary artery. This is the still picture which actually sees like this. And if you go to the video picture or a motion picture, you can see how actually the blood is flowing in that artery. You can see the all the branches of those artery, how the blood is moving. So this is the right side, and earlier I showed you the left side. So now this is another picture showing the surface, how these arteries are running on the heart. So you have a left side, you have a left coronary artery, and you have right side, you have a right coronary artery. So there are starting with two coronary arteries, left and right. So we will go to the next. You see the blood vessel. Blood vessel is nothing but you have a piping system in the home to supply the water. You have a piping system in the house. So when you, if you make a section of that pipe, that will be like a tube, isn't it? Just like that, even in heart muscles, these are blood vessels are running. If you take a cut section of that blood vessel, it will look like this. So it is a tube actually. See, this is the tube, very smooth tube. And when you bring a new pipe, how it will be? It will be very nice. Inside and outside, it will be shining, so smooth. There will not be any obstruction within the tube. But the same water pipe, after 5 years, 10 years, 15 years, what happens? There will be formation of the, a lot of changes will occur, junk formation. So then the then the outside also looks hazy and bad, and also inside also there will be lot of changes in those pipes. You must have seen old, especially old houses with old pipes. You might have seen there may be choking of the these pipes also, you might have seen in your home. So this is actually a normally looking cut section of the blood vessel. So if it is like this, then the blood will be flowing very smoothly, very nicely. There will not be any problem in the flow. But what happens in body? So just like rusting occurs in pipes in our house, like that only there will be changes in the these blood vessels, and the rusting occurs. Rusting occurs because of deposition of the fat, cholesterol. So because of deposition of the cholesterol in this lumen, it starts getting occluded. So I will show you the next picture. You can see here. See this yellowish material you can see here. This is the fat which has been accumulated in the lumen of the blood vessels. And also there is a blood clot here. You can see once there is a blood clot and lot of this fatty tissue is accumulated in this blood vessel, then the blood vessel gets choked. So if the blood vessel gets choked and if it is occluded, there will not be any blood flow to the muscle, and muscle will die soon. So that is the situation where we call it as heart attack. So we know that this lipid or fat or cholesterol is getting deposited here in this blood vessel. This is the most important cause of heart attack. See, I showed you some of the blood vessels there in the earlier picture. You can see this is the normal looking blood vessel. So you can see here. Now you see the one more blood vessel here. There is almost is not seen in between. So there is a block here. Because of that block, it looks like as if it is discontinuous. You can see some normal blood vessel here and normal blood vessel here, but there is a block here. So this kind of blocks will occur in the body because of many reasons. So this will lead to occlusion of the blood vessel and produces heart attack. So this actually we should prevent. So when heart attack occurs, what are the usual symptoms? Usually patient complains of chest pain. So if anybody is complaining of chest pain, you should always take them to doctors immediately. So that because most of the problems occur in first hour or first few hours. You might have heard sudden cardiac deaths or sudden death that 5-10 minutes back he was all right and he suddenly collapsed. So those kind of risk is there in first hour and first few hours of the chest pain. So just whenever there is a chest pain, try to rush to hospital as early as possible. So and that time there may be sweating, patient may have other complaints of like he may become unconscious, and there may be collapse, and pain may be severe, he may be sweating, and some people may have breathlessness, that means difficult to breathe, so giddiness. So all those things can occur during heart attack. Now, why heart attack occurs, or why there is a rusting problem in the blood vessel, why the obstruction occurs in the these blood vessels in the heart, we should know. Then only we can prevent. So, the most important causes which have been listed is, one is aging. So, as age advances, like after at the time of birth, there is no obstruction at all. But when you reach 10 years, 20 years, 30 years, 40 years, like that, there will be some changes will occur, wear and tear will occur in the body. Because of that, some of the obstruction will occur. That is called aging process. So it affects, aging affects all the organs in the body. Like that, even the blood vessels are also affected. So this is the aging phenomena. This we cannot change because aging is a natural process that will anyway happen. We cannot reverse the age currently. And also, second is sex. Usually males are more prone for this kind of obstruction, heart attacks, because in females, during especially during their reproductive age group, that is from 15 to about 50 years, they have female hormones. These female hormones are cardioprotective. They actually prevent formation of these cholesterol deposits. So they are protected between that age group. So females are less prone, but males are more prone. So then we have family history. As I said, if somebody, father, mother have had heart attack, or father, mother have died because of heart attack, then the risk of getting heart attack increases in the children. So they should be careful to, so that they practice good tobacco, high blood pressure, diabetes, and cholesterol level in the body, obesity, physical inactivity, and then of course I talked about mental health, mental stress. So these are all the causes of obstruction which occurs in the blood vessels of the heart, and these are the main causes of the heart attack. We'll discuss one by one. I told about age and sex. The aging is one of the important cause, but we cannot do anything for it, and also we cannot change the sex also. So genetic causes are there. As I told, if father mother have the history, then children's may have the risk of developing heart attack. So then another important thing is, you might have heard about high blood pressure. Blood pressure is high. So normally we take it as uh, 140/90 as the cutoff. If the pressure is above 140/90, then we call it as high blood pressure. Whenever there is a high blood pressure, then it can damage the blood vessels and it can produce obstructions. So after the age of 18, at least once blood pressure should be checked in all the individuals. So if it is normal, then you get it checked every 5 years. If it is slightly on higher side, then it may be preferable to measure every year. So all PUC passed out, those who are entering into degree, should undergo at least once, their blood pressure should be checked, so that, because blood pressure, high blood pressure, we will not come to know without measuring. So measurement has to be done. So this is one of the recommendation, that above the age of 18, at least once they should get checked up. So blood pressure is also an important cause of heart attack. Then of course, cholesterol, lipids. So in body we have cholesterol. Actually, cholesterol is needed for the metabolic activity of the body. But what is circulating in the blood, if it is high, then it can get deposited in the blood vessels. So this can the body is damage to the heart. So we actually, this cholesterol is divided into four groups. One is called total cholesterol, another is called low density lipoprotein, another is called high density lipoprotein, and the fourth group is triglycerides. So this LDL, low density lipoprotein, and triglyceride is toxic to the blood vessels, while HDL, high density lipoprotein, actually it actually reduces the obstruction. So in body, when we measure, our LDL cholesterol should be lower side, our triglyceride should be on lower side, while HDL should be on higher side. Then we will not get heart attack. So uh, after the age of 18, at least once the lipid profile should be, blood test should be done, and if it is normal, then get it checked after 5 years. If it is slightly abnormal, then maybe every year you may have to check and get it treated accordingly, so that you can practice a good lifestyle if there is a risk. See, the most important change which has occurred over a period of time is change in our lifestyle. See, the man who used to live in caves long back, his main way of living was to fight with the animals and get the food, eat it, and relax. That was the only thing which he used to do. But over a period of time, what happens? We call it as modernization, civilization. So the people started, animal husbandry, agriculture came into picture. Once there is a, the civilization takes place. Once the civilization took place, earlier what we were doing, we stopped doing that. So earlier it was more of physical activity. The man who used to be in the caves, his daily routine was more of a physical activity. There was no mental stress in such situation. But now you see a modern man, he does less physical activity. We are dependent on all mechanical devices. So our every work is done by equipments. So our physical activity has come down, but our mental stress. Imagine everyone is facing mental stress nowadays. So physical activity has come down while the mental stress has increased a lot. So because of that and changing lifestyle, the man become poor, and all the problems have started because of changing lifestyle. So you can imagine, even the kids nowadays are not playing any outdoor games. They are only playing indoor games, more of digital activities. So you, especially after COVID-19, all kids are equipped with mobiles, and they are addicted to mobiles and mobile based or digital based games. So this puts, no physical activity, but only mental activity. So there is an imbalance in the body, which leads to lot of problems in the heart also. So this is lifestyle related changes which have led to these kind of problems. And also in our day-to-day life, now we are all dependent on junk foods. So all fried items and ready to use items, we have to just order over Zomato or whatever these apps are available nowadays. So you just order, it comes to your home only. So no question of preparation also. So that is where we are reaching. See, after the COVID, we became work from home, no mobility at all. Now what is happening? Work from bed. That is the situation which we are reaching. So no physical activity. Because of this, our weight will increase, our sugars will rise, our cholesterol will rise, and we will be more prone for heart attack. And also you see, over last 30-40 years, what has happened in our homes? Earlier ladies used to prepare food manually. Everything used to be manual. But with the advent of science, the mechanical equipments came to market. So fridges came, grinders came, mixtures came, so that no physical activity at all for even for ladies. So nowadays, because of this changing lifestyle, ladies are also experiencing more and more heart attack. And if you the screen time, now what we call it as earlier, in 80s and 90s only TV was available. People used to watch TV. Now everything is digital, so social media. So we calculate screen time. See, one of the uh, the analysis showed that if you watch 1 hour TV, your lifetime will come down by 1 minute. So you can imagine what is happening to our because of increasing screen time and no physical activity and sitting activities, how our lifestyle is becoming very bad. And also food what we consume is also very important. So if you are consuming, people talk, hey, I am a pure vegetarian, I should not get this and that. But that is not the situation, because if you are eating more fried foods, if you are consuming more cholesterol, if you are consuming more oily foods, then there is no question of vegetarian or non-vegetarian. Both vegetarian as well as non-vegetarian will be prone with the same risk. So you have to change your food habits, and you have to avoid junk foods. And the most important cause of heart attack is consumption of tobacco. So the smoking, cigarette smoking, bidi, hookah, gutka, any form of tobacco is very, very injurious to body. Tobacco not only damages heart, but it actually damages lungs, it damages nerves, it damages brain, and it is cause of many kinds of cancers also. So most of our younger generation who are studying in PUC, usually they will not be addicted to tobacco, but by the time they enter degree, that is the time where they are prone for habits, bad habits, whether it is alcohol or whether it is smoking or it is drugs. So it is usually during the degree level. So this is a time where you people have to control yourself, and you should be aware of the negative ill health of these, whether it is smoking or consuming alcohol or taking drugs. So it should be very, very dangerous to your health, both physically, mentally, as well as socially. All three dimensions will be damaged with these bad habits. So I request all those who are listening, kindly uh, take this advice and don't get into bad habits. It is usually friends pressure which makes you, smoke 1 or 2 times initially, and then it starts going on increasing and increasing, then you will become addicted. Similarly, alcohol. Hey, do you take beer? Nothing will happen. So once, twice, thrice, and then you start drinking regularly. So you will become addicted like that. So whether it's drugs or smoking or this one, you should not do if you want to keep a good health for long time. So please practice. So another important risk factor is sugar patients. Those who have higher sugars, they have got a higher risk of heart attack. Then of course I tried spoke about obesity. The obesity means actually overweight. See, nowadays most of our Indians are overweight. You can see their stomach is always, like this. So this is not a sign of prosperity. This is a sign of ill health, because you are more prone for hypertension, you are more prone for diabetes, you are more prone for hypercholesterolemia, and you are more prone for heart attack and strokes. So obesity is a bad marker of heart. So what is happening is changing lifestyle. So you just, without doing any physical activity, you take lot of calories. Like drinking not only alcohol, even what we take, the carbonated the beverages. So these cool drinks also have got lot of calories. So if you doesn't do any activity and just sit and watch TV and consume lot of these carbonated drinks, then your weight will increase. So that is again a bad thing to do. So alcohol, I told, it's very dangerous to the, not only to the heart, to the brain, to the lungs, to the kidneys, to the liver. So, lot of cancers, many things are associated with alcohol. So, don't get into this bad habit. Of course, when we talk of heart attacks, so we will not go into the treatment aspect, because what you have to do is, whenever there is a chest pain to any person, just take him to the emergency, nearest emergency, whichever is available. If there is a if you need an help, you can call 108, which is now available, and they can send the ambulance to your places. So how we can prevent heart attack or whatever problems which the younger generation is facing nowadays, is because of heart attack is mainly because of changed bad lifestyle. So we have to bring changes in our lifestyle. So we have to involve more physical activity. So we have to promote physical activity. So our kids should play outdoor games. So earlier people used to, skipping, lagori. There are so many sports were available for the kids to go around and play. So reduce digital activity, increase physical activity. That should be the our motto and slogan to have a healthy lifestyle. So we should increase and promote. And also people should get back from the mechanistic life to manual life. So at least some physical activity if we do in the house and home, then even what is the problem now ladies are facing, that can also be reduced. It is not only for ladies, but even for males also, they should involve actively in the house activities, manually, physically. Then your physical activity will improve. So just try to avoid staircase. This use staircase to climb one or two floors, avoid lift. So these are the changes. Use cycle instead of by your motorcycle to travel shorter distances at least. So that those kind of changes has to be brought in our daily life, so that we'll lead a healthy life. Even use of oils. So Saffola uh, oil is a better oil which is recommended. So generally it is available, so that can be used. There are many oils like groundnut oil is available. So other oils are also available. Overall the quantity should be less, as minimum as possible, and avoid repeated frying. When you repeatedly fry the oil, it will become trans fatty acids. Because of repeated frying, it will be converted into trans fatty acid. So these trans fatty acids are very dangerous to the body. So avoid repeated frying, which we generally do. Puggi avella tintarala. So adರಲ್ಲಿ we have to be careful. And of course, I am been talking about physical activity, physical activity, physical activity. So what can prevent heart attack, what can promote a good health is physical activity. So involve in more physical activity, so that once you do your physical activity, your muscles will be strengthened, your bones will be strong, your heart will be strong, and whatever the markers which we have, like cholesterol, sugar, blood pressure, they will be under control. So physical activity is the one of the ನಾವೇನು ರಾಮಬಾಣ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, ಪೆನೇಶಿಯಾ ಫಾರ್ ದ heart attack. So that we have to keep in mind. And of course, I was talking about junk food. So we should, especially in children's, we have to change this habit, food habit. From junk foods, they should eat more vegetables, more fruits, green leafy vegetables. That will, antioxidants will be taken more. So these fried, all those junk foods are very toxic to the body and heart, and they are also addictive. Last, what happens with the Maggie and all those few years back, you must have read in the papers. So we have to bring change in our day-to-day food habits. It's very important. ಸೊ ನಮ್ಮ ಕಡೆ ಹೇಳ್ತಾರೆ ಕನ್ನಡದಲ್ಲಿ, ಒಂದು ಸಾರಿ ಊಟ ಮಾಡುವವನು ಯೋಗಿ, 2 ಸಾರಿ ಮಾಡುವವನು ಭೋಗಿ, 3 ಸಲ ಮಾಡುವವನು ರೋಗಿ, 4 ಸಲ ಮಾಡಿದವನ್ನ ಹೊತ್ಕೊಂಡು ಹೋಗಿ ಅಂತಂದ. ಅಂದ್ರೆ ವಾಟ್ ಎವರ್ ವಿ ಹೀಟ್, ಇಟ್ ಶುಡ್ ಬಿ ಲಿಮಿಟೆಡ್, and what is it which is required for the body should be taken. So we should always think that we have not come here to eat. For living purpose, what is required, that should be taken. So it should not be overeating. Overeating will lead to weight gain. So what is important is we should have a good food habits and less mental stress, that will prevent heart attacks. So we talked about these arteries, which are the blocks which occur in the arteries. If there is a block, then science has developed and this can be treated. You can see here, this is a blood vessel which is actually having a block here, and this is a blood vessel which is having a block here. So these blocks now scientifically we can treat. So I will show how we treat. See, this is a section of a blood vessel. You can see red here. This is the muscle here. You can see, and you can see this yellow portion, which is actually deposition of the lipids or fat or cholesterol is deposited here. So because of this, the lumen is choked. Now what we do is we place, you can see one material has been kept here, and you can see a spring coil which is placed above this material. So what we do is we place where the obstruction is there, and then what we do is, yeah, we inflate the balloon inside. So once we inflate this balloon, you can see the mesh. They're just like a refill has got a spring coil inside. Like that, this there is a spring coil. This we call in cardiology as stent. So this stent gets expanded. So the previous one, you can see this is not expanded. It is a collapsed stent, so which is mounted over a collapsed balloon. But once we inflate this balloon, so this stent will expand, and then we'll take out that balloon. So that will remain there. So that is a pictorial form. This is a picture, but now I can show you exactly what we do there. This is the last week which we did an angiography and then angioplasty and stenting to a blood vessel. See, this is the right artery which is blocked here. Actually, this is the right artery. From here to here the artery is seen, but subsequently the artery is seen not afterwards. So what we do is, you can see the second picture here. There is a one wire inside which I am pushing here. So this wire is going inside the artery. And third picture, you can see that wire I have passed it till the end of the blood vessel. After passing that, now I can see the blood vessel. See, in the first one, I can see it here. The second one, I can see it here. The third one, I can see the blood vessel till here. So this is the right coronary artery. So once I pass that wire, so you can see here, this is now seen better. Now I have placed a stent here. You can see here, this is the stent which has been expanded. So once I expand the stent, and then you can see the last picture here. Now you can see the blood vessel is the right coronary artery is fully seen. So this is how we treat when there is obstruction and blockage is there. That blockade can be cleaned with the placement of the stent and balloons. So with that we call it as, you might have heard that patient, somebody had heart attack, and angioplasty and stenting was done to that patient. So this is the procedure which we do in the department of cardiology. So these are exciting things. So those who are interested in medicine, so they will be, so to prevent, we know that now the heart diseases have increased because of our bad lifestyle. So there is a World Heart Federation which actually every year on September 29th they observe World Heart Day. Vishwa Hridaya Dinachರಣೆ ಅಂತ. World Heart Day is observed on September 29th. So the main motto of this is to create awareness, just like what I am talking to you people. Like that, there will be many programs which we do on September 29th to create awareness about our diseases, so that we bring back good lifestyle and prevent whatever cardiac problems which are occurring. So every year we work with one slogan. So you can see in 2013, Arogyakara Hridayada Marga. That means take the road to a healthy heart. This was a slogan in 2013. So you can see here how the road to healthy heart is available. So cycling, playing in the park, so walking with pets, playing outdoor games. So that is how the road to healthy heart was designed. So that was in 2013. Then in 14 it was create a heart healthy atmosphere. So ಉತ್ತಮ ಹೃದಯ ಪರಿಸರ ನಿರ್ಮಿಸಿ ಅಂತ ಇತ್ತು. So every year we do a campaign with a slogan. So in last year we did 2000 this year 2023 September 29th, the slogan was use heart no heart, ಅಂದ್ರೆ ಹೃದಯ ಬಳಸಿರಿ ಹೃದಯ ಅರಿಯಿರಿ ಅಂತ. So means use your heart and be aware of heart. So ಹಾರ್ಟಿಗೆ ಯಾವ ರೀತಿಯ ತೊಂದರೆಗಳು ಬರ್ತವೆ, ಅದನ್ನ ಯಾವ ರೀತಿಯಾಗಿ ನಾವು ಪ್ರಿವೆಂಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಅರಿಯಿರಿ ಅಂತಂದು ಈ ವರ್ಷದ ಒಂದು ಸ್ಲೋಗನ್ ಆಗಿತ್ತು. ಸೊ this was observed this year as use heart no heart. So this is what I talked you all. So basically when you talk of heart diseases, there are many heart diseases like valvular heart disease, conduction system problems, myocardial problems, heart attack. So many things are there, but as an individual which we are more prone is heart attack nowadays. So we should know how to prevent it, basically by adopting a good lifestyle, a healthy food habits, physical activity, reducing mental stress, and socially well-being, and avoiding all bad habits, avoid tobacco, avoid alcohol, say no to drugs. So these things will go a long way in achieving good health of an individual as well as the society, so that we build a great India. Thank you all.
ಡಾಕ್ಟರ್ ಸಾಬ್ ತುಂಬಾ ಬಹಳ ಅದ್ಭುತವಾಯಿತು. ಮತ್ತೆ ಟಾಕು ಸ್ವಲ್ಪ ಒಂದು 5-10 ನಿಮಿಷ ಲೇಟ್ ಆಯ್ತು, ನಾನು ಜಾಯ್ನ್ ಆಗಿದ್ದು, ಮೀಟಿಂಗ್ ಹೋಗಿದ್ದೆ. ಅಗೇನ್ ವೆರಿ ವೆರಿ ಗುಡ್ ಇನ್ಫಾರ್ಮೇಟಿವ್ ಟಾಕ್. ಯು ಸ್ಪೋಕ್ ಆನ್ pathology and prevention. Doctor, I'm sure all of the students who have joined have taken a lot of take-home message from your talk. 2 ದಿವಸನೂ ಬಹಳ ಅದ್ಭುತವಾಗಿ ಹೃದಯದ ಬಗ್ಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿ ವಿವರಣೆಯನ್ನು ನೀಡಿದರೆ ಅಕಾಡೆಮಿ ಪರವಾಗಿ ಹಾಗೂ ಈ ಒಂದು ವೆಬಿನಾರ್ ನಲ್ಲಿ ಸಿಸ್ಕೋ ವೆಬ್ಎಕ್ಸ್ ಮತ್ತು ಯೂಟ್ಯೂಬ್ ನಲ್ಲಿ ಜಾಯಿನ್ ಆಗಿರೋ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿಗಳ ಪರವಾಗಿ ಬಹಳ ಧನ್ಯವಾದಗಳು ಡಾಕ್ಟರ್. We are very grateful to you in spite of your very busy schedule. You could make time to deliver these 2 excellent talks. Once again, thank you, sir. Doctor,
Yes sir.
Before we close, we have a couple of questions.
Yes sir.
ಈ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಮೊದಲೆಲ್ಲ ಅಬೌವ್ 40 years ಆದ್ರೆ ಬರುತ್ತೆ ಅಂತ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ರು. ಈಗ ಚಿಕ್ಕ ಹುಡುಗರಿಗೂ ಎಲ್ಲ ಬರಕ್ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. ಅವ್ರಿಗೆ ನಮ್ಗೆ ದೊಡ್ಡವರಾದ್ರೆ ECG ಎಲ್ಲ ಮಾಡಿ 40 years ಎಬೋ ಇರೋರ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಹುಡುಗರಿಗೆ ಯಾವ ತರ ಮೊದ್ಲೇ ನಾವು ಇವ್ರಿಗೆ ಹಾರ್ಟ್ ಡಿಸೀಸ್ ಇದೆ ಅಂತ ಹೆಂಗ್ ಗೊತ್ತಾಗುತ್ತೆ? ವಿ ನೆವರ್ ಡೂ ಎಕೋ ECG ಆರ್ 2D ಎಕೋ. ಸುಮ್ಮನೆ ಆಟ ಆಡ್ತಾ ಇರ್ತಾರೆ, ಒಂದ್ ಜನನು ಸುಮ್ಮನೆ ಇರ್ತಾರೆ, ಸಡನ್ ಆಗಿ ಕೊಲಾಪ್ಸ್ ಆಗ್ಬಿಡ್ತಾರೆ. ಇದಕ್ಕೆ ಯಾವ ತರ ಅವೇರ್ನೆಸ್ ಬಿಲ್ಡ್ ಮಾಡ್ಬೋದು? ಒಂದೆರಡು ಮಾತು ತಮ್ಮಿಂದ.
Yes sir, definitely. If you look at the statistics, so 25% of the heart attack is occurring below the age of 40 years. So what used to happen after 60, 70, the age shift is there. So as I spoke and I highlighted the main causes. See the bad habits, which the changing pattern of the lifestyle, the bad lifestyle has contributed to this problem. See now even when the baby enters the LKG, we start stressing them that you have to be 100%, you have to be 101%. So the mental stress is starting from LKG. And we have come down on physical activity and everything is digitalized. So this has contributed to even the overweight percentage in children. It is more than 5% now as per the statistics. So those risk factors are starting as early in the childhood itself, which used to happen after 2025, that has been shifted. So now younger generation is more prone for this problem. So what is important is we have to tell them about a good lifestyle, and avoid all the bad habits. So usually, as you know, the tobacco consumption and alcohol consumption, they are usually around 20 years of age when they enter into the degrees. So there the peer pressure comes, the friends, they force them to take all these things, and then that becomes a habit subsequently. So these are the areas which we need to focus and bring back good lifestyle in them, and prevent addiction to the bad habits. That is one aspect of preventing the heart problems. The second is promoting positive health. That I have also told.
Correct.
And screening is recommended at certain age. See, we usually recommend if you are above the age of 18, just at least one blood pressure needs to be checked up at the when they finish PUC and enter into any degree. That should be the screening area where all should have a one baseline evaluation, so that we know that they are normal. If there is some changes is there, then we can take precautions. So one lipid profile, cholesterol, one sugar, and blood pressure checkup at the age of 18 plus is recommended. If everything is normal, the recommendations are after 5 years. So once they have finished their degrees, then they can get an evaluation done. But if there is some abnormalities there, then we may have to go for annual checkup also. So I think school health program needs to be strengthened by the policymakers, so that we have a very good screening program, so that these things can be prevented.
Sir, second thing is, normally doctors prescribe ecosprin and statin for those who are above 40 in order to prevent heart problem. Is it recommended or just
No, we actually doesn't recommend medicines for primary prevention. Primary prevention means nothing has happened to them. So we doesn't prescribe. They don't have heart attack, we won't give them aspirin or statin. But if they have risk factors, they
No.
have diabetes, they have hypertension, their family of heart attack, their father, mother have died because of heart attack, their cholesterol levels are higher side, then we will consider for as a preventive measures, we may have to give them certain drugs. But if your cholesterol level is very high, then you have to take statin. That is a treatment of choice. So there that it becomes a therapeutic option, not as a preventive option. It's a therapeutic option. So generally, as in primary prevention, we straight away doesn't recommend at 40 or 50 you take aspirin or statin, but it is based on their overall risk of future events that will guide us.
ಸೊ ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಸರ್. ತುಂಬಾ ಅದ್ಭುತವಾಗಿ ಪ್ರೆಸೆಂಟೇಷನ್ ಎಲ್ಲ ಮಾಡಿದ್ರೆ. ಸರ್, KSTA ಆರ್ಗನೈಸಸ್ ಕಾನ್ಫರೆನ್ಸಸ್ ಆಲ್ಸೋ ಇನ್ ಕನ್ನಡ ಆಲ್ಸೋ. ಕನ್ನಡ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡ್ತೀವಿ. ಈ
Yes,
ಸರಿ
sir.
ಮಾಡಿದಾಗ ತಮ್ಮನ್ನ ಇನ್ವೈಟ್ ಮಾಡ್ತೀವಿ, ತಾವು ಬಂದು
ಡೆಫಿನೆಟ್ಲಿ ಅದರಲ್ಲಿ ಭಾಗವಹಿಸ್ಲಿಕ್ಕೆ ನಾನು ಐ ವಿಲ್ ಬಿ ವೆರಿ ಕೀನ್.
ಅವೇರ್ನೆಸ್ ಜಾಸ್ತಿ ಬಿಲ್ಡಪ್ ಮಾಡಬೇಕು ಅಂತ ನಮ್ದು ಒಂದು ಉದ್ದೇಶ. ತಮ್ಮನ್ನ
Yes, sir.
ಮಾಡ್ತೀವಿ, ತಾವು ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ಕೊಂಡು ಬಂದು ಟಾಕ್ ಕೊಡಬೇಕು. ವಿಲ್ ಇನ್ವೈಟ್ ಯು.
Definitely.
Most probably in the month of January or February, we will be organizing a Kannada conference.
ಓಕೆ ಸರ್, ಯಾಕಂದ್ರೆ ನಮ್ಮ ಶಿವಮೊಗ್ಗದಲ್ಲಿ ಮೊನ್ನೆ ಮಾಡಿದ್ವಲ್ಲ ಕನ್ನಡ ಇದು, ಸೊ ನೀವು ಬಂದಿದ್ರಿ. ಸೊ ಇಟ್ ವಿಲ್ ಬಿ ವೆರಿ ನೈಸ್ ಟು ವರ್ಕ್ ವಿತ್ ಯು ಪೀಪಲ್.
Yes, sir.
ಆಕ್ಚುಲಿ ಆ ಕಾರ್ಯಕ್ರಮ ಮಾಡಿದ್ದೇನೆ ನಿಮ್ಮ ನಡುವೆ ಒಂದು ಸಂಬಂಧ ಏರ್ಪಡ್ಲಿ ಅಂತಾನೆ ವಿ ಇನಿಷಿಯೇಟೆಡ್ ದಟ್ ದಿಸ್ ಒನ್.
Yes, sir. We will organize many joint programs in association with IMC in future. Thank you very much, sir.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಸರ್, ಮತ್ತೊಂದು ಪ್ರಶ್ನೆ ಇದೆ ಸರ್.
ಕೇಳಿ
ಸರ್. ಈಗ ಕೆಲವೊಂದು ಹಳ್ಳಿಗಾಡು ಪ್ರದೇಶ ಮತ್ತು ನಗರ ಪ್ರದೇಶಗಳಲ್ಲಿ ತಾವು ಹೇಳಿದಾಗೆ ಕೆಲವರು ನಾನು ನೋಡಿರುವ ನನ್ನ ಒಂದು ಅನುಭವಕ್ಕೆ ಬಂದಂತ ಸಂದರ್ಭದಲ್ಲಿ ಬೆಳಗ್ಗೆಯಿಂದ ಸಂಜೆವರೆಗೂ ಸ್ಮೋಕ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ಮತ್ತೆ ವರ್ಷ ಪೂರ್ತಿ ಮತ್ತೆ ಡ್ರಿಂಕ್ಸ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಸೊ ಅವರ ಆರೋಗ್ಯ ನಾನು ನೋಡೋ ಮಟ್ಟಿಗೆ ಅವರೆಲ್ಲ ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಅದ್ರ ಬಗ್ಗೆ ತಾವೇನ್ ಹೇಳ್ತೀರಾ?
ಈಗ ಒಂದು ರೂರಲ್ ಅರ್ಬನ್ ಡಿಫರೆನ್ಸಸ್ ಬಗ್ಗೆ ಮಾತು ಬಂದಾಗ, ಅರ್ಲಿಯರ್ ದೇರ್ ವಾಸ್ ಅ ಡಿಫರೆನ್ಸ್. ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಈ ಕಾರ್ಡಿಯೋವಾಸ್ಕ್ಯುಲರ್ ಡಿಸೀಸಸ್ ಇನ್ಸಿಡೆಂಟ್ಸ್ ಕಡಿಮೆ ಇತ್ತು, ನಗರದಲ್ಲಿ ಜಾಸ್ತಿ ಇತ್ತು. ಬಟ್ ಲಾಸ್ಟ್ 20-30 ಇಯರ್ಸ್ ಅಲ್ಲಿ ಏನಾಗಿದೆ ಅಂದ್ರೆ, ದೇರ್ ಇಸ್ ಅ ಡೆಫಿನೆಟ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಇನ್ ದ ರೂರಲ್ ಏರಿಯಾಸ್ ಆಲ್ಸೋ. ಇವತ್ತು ನೋಡಿ, ಮೊಬೈಲು ಪ್ರತಿಯೊಬ್ಬರ ಹತ್ರನು ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಮೊಬೈಲ್ ಇದೆ, ಒಬ್ಬೊಬ್ರು ಎರಡೆರಡು ಇಟ್ಕೊಂಡಿದ್ದಾರೆ. ಸೊ ಆ ರೀತಿಯ ಬದಲಾವಣೆಗಳು ಇವತ್ತು ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಆಗಿದ್ದಾವೆ. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ಚೇಂಜಿಂಗ್ ಲೈಫ್ ಸ್ಟೈಲು, ಸೊ ಅಲ್ಲಿನೂ ಏನ್ ಡಿಫ್ರೆನ್ಸ್ ಇತ್ತು, ನಾವು ಹೇಳ್ಬೇಕಾದ್ರೆ ಸಪೋಸ್ 6 to 8% ರೂರಲ್, 8 to 10% ಅರ್ಬನ್ ಏರಿಯಾ ಅಂತ ಮೊದಲು ಹೇಳ್ತಾ ಇದ್ವಿ. There was about 2 to 4% difference. But ಇವಾಗ ಅಷ್ಟಿಲ್ಲ, ಅದು ಇಟ್ ಮೇ ಬಿ 1 to 2% ಅಷ್ಟೇ ರೂರಲ್ ಅರ್ಬನ್ ಡಿಫರೆನ್ಸ್ ಏನ್ ನೋಡ್ತಾ ಇದೀವಿ. ದಟ್ ಈಸ್ ಬಿಕಾಸ್ ಆಫ್ ಚೇಂಜಿಂಗ್ ಲೈಫ್ ಸ್ಟೈಲ್. ಆಮೇಲೆ ಎರಡನೇದಾಗಿ ನೀವು ಹೇಳಿದ್ರಿ ಕೆಲವೊಂದು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ಗಳು ಅವ್ರ ಹತ್ರನೂ ಇದ್ವು, ಆದ್ರೂ ಅವರು ಚೆನ್ನಾಗಿ ಇರ್ತಾ ಇದ್ರು. ಯಾಕಂತೆ? ದಟ್ ಈಸ್ ಬಿಕಾಸ್ ಒನ್ ಈಸ್ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್. ವೆನ್ ಯು ಕಂಪೇರ್ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಇನ್ ರೂರಲ್ ಏರಿಯಾಸ್ ವರ್ಸಸ್ ಟಾರ್ಗೆಟ್ ಬೇಸ್ಡ್ ಲಿವಿಂಗ್ ಇನ್ ಅರ್ಬನ್ ಏರಿಯಾಸ್. ನಮ್ಮ IT-BT ನಲ್ಲಿ ಇರೋರಿಗೆ ಎವ್ರಿ ಡೇ ಟಾರ್ಗೆಟ್, ಸೊ ಅಂಡ್ ವೀಕೆಂಡ್ ಆಫ್ ಟೋಟಲ್. ಸೊ ಆ ರೀತಿಯ ಲೈಫ್ ಸ್ಟೈಲ್ ದೇರ್ ಇಸ್ ಅ ಹ್ಯೂಜ್ ಡಿಫರೆನ್ಸ್. ಸೊ ಈವನ್ ಇಫ್ ದೇ ಆರ್ ಸ್ಮೋಕಿಂಗ್, ಬೇರೆ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಗಳು ಸತಾಗೆ ಅಲ್ಲಿ ಇನ್ಫ್ಲೂಯೆನ್ಸ್ ಮಾಡ್ತವೆ. ಸೊ ನಿಮ್ಮ ಜೆನೆಟಿಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಆಲ್ಸೋ ಕೌಂಟ್. ಈಗ ಮೊದಲಿನವರು 70 ವರ್ಷ, 80 ವರ್ಷ, 90 ವರ್ಷ, 100 ವರ್ಷದವರೆಗೆ ಬದುಕಿರ್ತಾ ಇದ್ರು. ಸೊ ಈಗ ಅದು ಕಡಿಮೆ ಆಗಿದೆ. ಸೊ ದೇರ್ ಆರ್ ಜೆನೆಟಿಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಪ್ಲೇ ಇನ್ ರೂಲ್. ಅಂಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಲ್ಲಿ ನೀವು ಮ್ಯಾನ್ಯುವಲ್ ವರ್ಕ್, ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ಜಾಸ್ತಿ ಇದ್ದಾಗ ಬೇರೆ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಗಳನ್ನ ಆಫ್ಸೆಟ್ ಮಾಡ್ಕೊಳ್ತೀರಿ. ಸೊ ದೇ ವಿಲ್ ಬಿ ಬರ್ನಿಂಗ್ ಮೋರ್ ಕ್ಯಾಲರೀಸ್. ಅವ್ರು ಬೆಳಗ್ಗೆಲಿಂದ ಸಾಯಂಕಾಲದವರೆಗೆ ದುಡಿತಾ ಇರ್ಬೇಕಾದ್ರೆ ಹೊಲದಲ್ಲಿ ದೇ ವಿಲ್ ಬಿ ಬರ್ನಿಂಗ್ ಮೋರ್ ಫ್ಯಾಟ್ಸ್ ಅಂಡ್ ಮೋರ್ ಕ್ಯಾಲರೀಸ್. that actually compensates for the ill effects of the smoking. So ಆ ರೀತಿ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ಗಳು ಡಿಫ್ರೆಂಟ್ ಆಗಿ ಬಿಹೇವ್ ಮಾಡ್ತವೆ. So that's why we get rural urban differences, but actually that is narrowing because of changing lifestyle which is occurring even in rural areas nowadays.
Thank you, sir. Thank you very much.
Thanks a lot.
Thank you very much, sir.
Thank you.
ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಸರ್ ಅವರು ಬಹಳ ಸಿಂಪಲ್ ಆಗಿ ಹೃದಯದ ಬಗ್ಗೆ ಎಲ್ಲರಿಗೂ ಅರ್ಥ ಆಗೋ ರೀತಿ ಹೇಳಿದ್ದಾರೆ. ನಿಮ್ಗೆಲ್ಲ ಇನ್ಫ್ಯಾಕ್ಟ್ ಹಾರ್ಟ್ ಬಗ್ಗೆನೂ ಅವ್ರಿಗೆ ಹುಡುಗರಿಗಿದೆ ಸರ್ ಚಾಪ್ಟರ್. ನಿಮ್ಮ ಹಾಕಿಂದ ಅವ್ರಿಗೆ ಬಹಳ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Thanks a lot.
Thank you all students. Thank you very much.